So welcome everybody. This is the first of our digital Maturometer Snapshot sessions, and I'll talk about that in brief when we get to that slide. I'm really delighted that we added this to our offering, and I will share some ideas around digital transformation, key trends in pharma with you on that topic today. So I'm Fonny Schenck, I'm the CEO of Across Health, and I'm hosting this webinar. So for those of you who do not know us, we are a pragmatic company. That means we have experience in all of these matters digital, and we're also end-to-end. That means that we do strategy and execution as well as impact measurement. So we go beyond strategy slides, and we also go beyond the flashy object. We do two things. On the one hand, we develop, execute, and measure customer engagement strategies in an omnichannel way, but the topic of today is more the second, digital transformation. So we offer two sides of the coin. Some companies just want one side or even one component of one side. So strategic parts, which is insight and strategy. And then secondly, we also execute the client intelligent execution, as well as where possible measuring the impact. ROI remains a key hurdle in pharma. I think it's still at number 3 in terms of key hurdles. So measuring results is quite key. So today we're here to look at, let's say, the birth of our first Maturometer Snapshot, which you can see to the right, sorry. We've been tracking digital transformation for about, this is the 11th year, so for 10 years already, 11th years, through the Multichannel Maturometer. We're actually going to send out a new version sometime April, probably sometime next week or the week after. And we typically get around 250 respondents, and it gives you a really good view of digital maturity in the industry. And the fact that we can go back to 2009, 2008 even, shows how you can see trends, of course, happening. I put a link to the most recent data there as well. And of course, you can run this internally to benchmark yourself internally, but also to benchmark yourself against the average of the industry, against the top 10 of the industry, etc., etc. So adding to that Multichannel Maturometer, which is run annually, we have decided to add a quarterly snippet of information called the snapshot. We only focus on one topic, typically 5 minutes. We're looking for 50 plus respondents, then we close it, and we do it in less than 1 month. And the first topic we decided on was digital transformation. Why digital transformation? Well, it's a word that's very often used, I think also misused, or very unclear, like digital, multi-channel, omnichannel, cross-channel. All of these words are used in a very different way, but there's certainly one element that's clear. Digital transformation, digital disruption is happening today. This is a slide that shows the market cap of different companies, of the top companies since 2006. And what you see since 2016, it's all green, which means the leading companies are all big tech companies, and that was quite different in 2006. The interesting thing, though, is that Microsoft, which is, has been around for a while, is actually still in the top 5. I think that's a very strong performance. But a company like GE, I didn't look it up, but I think their market cap is now not 383 billion, but maybe 15 billion or so at best. So they have totally lost it. So yeah, there's something happening. And the question is this big industry that's called healthcare, is that basically safe from these rivals, from these new threats? No, it is not. I think it's probably the last industry that big tech is eyeing. That's healthcare. You've seen a lot of, I think, news about Apple Health Records, Google, Microsoft as well. And one of the, I think, most pivotal findings was in early 2018, 3 big companies, Berkshire Hathaway, Amazon, and JP Morgan, decided to disrupt healthcare in their own companies by creating a kind of a grouping to identify where they could save costs and improve treatment. So that was 2018. You may not have heard a lot about it. I think there's some news about Amazon trying to encroach on retailers and pharmacy benefit managers, etc. But it's still relatively quiet, and I think that's a good thing for pharma because Jeff Bezos himself, who is of course not afraid of any risk, has found out to his detriment, I think, that the healthcare system is quite complex. So that's, I think, protecting the healthcare industry for a bit. But if you then look at this nice quote from Ernest Hemingway, the fact that it's relatively quiet and there's only a little bit of news doesn't mean it's not changing. So he says, like, how in his book, how did you go bankrupt? Well, there's two ways, gradually, then suddenly. And I think we are in the healthcare space, we're certainly in the gradual phase, so nothing much can be seen at the surface. But the suddenly will probably come. The question is only when. So how about digital transformation in life sciences today? First, maybe a short definition of digital transformation. There's many of them. I took the Gartner one because Gartner is kind of a reference in the space. And it says there's actually two things you need to have: digital technologies, we all know about them, but also supporting capabilities. And I think that will be a message that you will hear coming in the next few slides as well. So it's not only about technology, clearly not, it's also about supporting capabilities. And you need both to actually create a new digital business model. And of course, this word new digital business model can mean a lot of things. So what does that mean? I think pharma, to my understanding, has a different view of what that means versus other industries. And I'll come back to that later. So, looking back to the Maturometer 2018, from May 2018, May-June, one of the questions we asked there to 250 people, to on the one hand, global respondents, so global or regional staff, and secondly, also national or local staff. We said, okay, how fast do you think transformation is happening in your company? And you can see that the national and local team say, well, it's about 50% feel it's slow or very slow. And in the global groups, it's even more. So the pace is certainly not torrid, it's certainly not high everywhere. But there's at least a small group, around 20%, that says it's fast or very fast. Now, of course, this can be many things. So it may be too fast for some people, it may be too slow for other people, while the actual speed is okay. It is a perception in the end, but the perception is quite slowish. I think no surprise to you. But then there's a few, I think, interesting findings besides, let's say, what we see in our company as kind of requests we get, which become more and more strategic. You also see this kind of let's say early flowers, early spring thing in terms of digital budget. So the digital budgets have been going up since 2016 quite significantly. If you look at it from an absolute term, from 15.7% to 21.5%. So there's 2 years of incessant and significant growth. Of course, the question will be what it will be in 2019. I predict it will be higher still, but we'll have to see. Nevertheless, you need to put this into perspective. So this is the percentage of marketing budget that is put to digital. 20% is actually not a huge number. If you look at other industries, it's certainly not huge. And if you look at the total sales and marketing spend in pharma, and you look at this number, it's probably going to be 5 to 6% of the total sales and marketing spend. So that is still low, but there's clearly growth. So the question is this the first swallow of a digital spring, or what should we think of that? So we took these first ideas to the market and we said, okay, let's do the Multichannel Maturometer Snapshot, the first one, and let's focus the first issue on digital transformation. So we ran that in March 2019, and I'm totally happy to share some of the findings here with you. First, who was involved? Well, it's mainly digital multi-channel people, but also marketing, board members, market research, and whatever. So it's about 50% from digital. I think it's important to bear that in mind when you look at the numbers as well. We did do an analysis for digital versus, let's say, marketing, etc. We did not see a lot of differences, so we think the numbers are robust and representative for all of the groups, but nevertheless, I think it's good that you are aware of this. And we tried to segment the results into different cohorts of respondents. So we asked the question, how long have you been involved in digital transformation? And then we grouped those. So around 50%, 44%, and 4% at the bottom. So 48% has been engaged in digital transformation for at least 1 year. That's around 50% of the respondents. The other 50% have been engaged for less than a year. So either between 0 and 6 months or between 6 and 12 months. So that's around 52%. So a good balance of, let's say, companies or respondents with a longer participation in digital transformation and those that have just started or under a year. And the nice thing about segmenting it this way is that if you are just getting started, you could actually see what kind of hurdles, what kind of opportunities the ones experience that are already, let's say, further down the road. So it gives you kind of a predictive view of what you should be watching out for when you just get started. So there's good news. There is a virtuous cycle in place, and the virtuous cycle is illustrated by this chart and the next one. So again, looking at the three groups, so the bottom one underway for less than 6 months, middle part between 6 and 12, and the top section, and you see the N numbers below, is, let's say, has been engaged in digital transformation for over a year. If you combine the scores of 5 and 4, like very impactful change, you see that that number increases over time. So from year 1, it's already at 36%, 5 and the 4, but then it goes up over time. So that's good news. And the more you work on it, the more satisfaction you generate. So the fact that in the first 6 months, let's say only 36% sees high or relatively high impact is not, let's say, an indication that it will not improve. It should basically improve. So that's a good one. Second one is the same, but then we asked about how satisfied are you? So not impact, but satisfied. You see similar numbers. So in the top group, 44%, so they have been engaged in that for more than 1 year, is very, very happy. That's a big number. You don't see that same representation in the other groups, and in the group that just got started, basically there is nobody who feels totally satisfied. That's normal, but you can see that it pays off to actually persist and continue. Okay, what will be key components? So what do you need to do? What are key enablers to make digital transformation happen? I think that's important. What are the building blocks, the success factors, the stepping stones, and whatever? I very often use this, the Gleicher model. And Gleicher is actually is an Austrian philosopher, and he came up with these 4 key components of success, and I strongly believe in these 4 components. There's many more models. Every model has its merits. This one probably also has its flaws. I tend to use it, and people also quite quickly understand it and can certainly apply it to pharma, their own company, quite quickly to see what is missing and what is there already. So there's 4 components. He says you need to have a need for change. You need to have a vision for where you're going. you need to be able to change, and you also need to set the first step towards change. You need to have all of those four in place, and then you will have successful change. If you miss out on the first one, so if you don't have the need for change, you don't know why you're changing, and very often hear companies say, well, we don't need this, we know we need to do digital, it's very important, and we just need to do it. I don't think that is a well quantified and well metricized need for change, or the burning platform, as we call it, is not well enough defined. If you don't have that in place, you have a slow start. People don't feel the urgency of doing it. They don't see what they should be doing and what the potential threats and opportunities are, so you have a slow start. If you don't have a vision and goal, like everything in life, if you don't know where you're going, you go in all directions. So you need to have a roadmap, you need to have an aspiration, a vision, and a well-defined strategy over multiple years. If you don't have that, people go in different directions and you have lack of coordination. If you would have number one, burning platform, great strategy, number two, but you don't have the technology or the capabilities or the governance or the KPIs or whatever to make it happen, you get frustration. And if you would have all first three elements in a row, but you don't know what to do next, so what is the key pilot we're going to do, what is the key program we're going to undertake, you get a lack of action as well. So I like this model very much, hope you like it too. So to really make digital transformation work, or any transformation, any change work, you need all four. That gives you successful change. All right, coming back to the pharma industry and our topic, I'm going to do a quick poll with you. Okay, all right, so poll question one. What is the most important component of a transformation strategy in life sciences? You can have a look here and please cast your votes, and then we'll have a short discussion. So is it assessment, capabilities, change management, dashboards, technology, business case, or other? Okay, so this is the result. Change management is seen as the top component. The other one's much less so. It's actually interesting that technology is not mentioned. So I think that on the one hand, it's a good thing because it is not the leading, let's say, element. Change management, this capabilities is a strong third, and the disease assessment is second. So I will share with you what the three different segments have actually said. Some of it rings true and some of it is different, so we can close the poll. And let's see what the people said. So the top one was change management. Maybe, I don't know, maybe this is the group of people in the session is actually just getting started or has a particular difficulty in their company, because change management communication is never a top answer here. It's number 4 for the let's say the starting group, but then it drops significantly if you move through the year. So in the companies that have been ongoing for over a year, it's actually one of the lowest priorities with 4%. So it drops significantly after 1 year. Now, my perception, and I will come back to that later, I think it's something that's very often easily forgotten. So I really support those who said change management is key, because communication is key, repetition is key. And what you see here typically is that after 1 year, everybody feels that the job is done and we can go back to our business. That is not true, and you will see that come back later. Nobody mentioned technology, although the first, let's say the early group actually finds technology the top component. So I think also an over exposure over belief in that technology will solve the whole thing. That is, of course, not the truth. Capabilities were mentioned, I think, third. So capabilities actually are rising through the ranks, as you can see, from 14% to 17%. Processes, KPIs, multi-year strategy become much more important. So they're green. And the change management part actually, according to the people who responded at least, is becoming less important. So that's an interesting, I think, observation that you chose change management and highly and technology low. I think illustrating particularly that you believe that it's more a human thing than a technology thing, because technology is something you can buy, which is totally true. So components, there are success factors, so there is a virtuous cycle. People get more satisfied, people feel there's more impact, they look at different components. Of course, we also need to look at the key bottlenecks, and we have a question on that. What, according to you, is the most important bottleneck of a transformation strategy? Have a look at the questions and the answer, and feel free to vote, and we'll have a short debrief of the answers there. Okay, let's see what the results are. Yeah, this group is slightly different from the other group, which is interesting. So no clear ambition or roadmap. Again, I would let's say really side with you on this. What you also saw in the previous slide on the components, that this becomes more and more important as you move throughout the journey. So the longer you're in the journey, the multi-year roadmap becomes more important. Skill gap now gets number 2. I think that's a good one, and lack of internal engagement is number 3. So there is quite some, let's say, some linkages to what the others voted, and I will share the results with you now. So these are the key hurdles, again segmented by stage. Skill gap is increasing over time. So in the initial, for let's say the first group, it's actually lack of internal engagement, just leading just before the skill gap, but then skill gap starts to increase significantly. Nevertheless, the lack of internal engagement remains a solid number 2. And I think that really brings us back to the previous question when we said, okay, what are key components of successful change? Change management communication was, according to you, a key one, because it actually decreases over time. You can expect that the lack of communication actually leads to a lack of engagement over time as well. So the other interesting part is that there's 11% of the most advanced group who feels there is no real bottleneck. So these are very positive people as well. So skill gap, again, it's a key component of it. It's also a key hurdle, and this probably will never change because digital is moving so fast with apps and social media and predictive analytics and health tech and whatever. Every year there's something, at least 2 or 3 new things. So it will probably never change, and people will never be fully trained on that. So maybe the answer to training people consistently is, let's say, skipping 25 years and actually start recruiting here. Okay, coming to an end of the session. What I see more and more, there's a lot of confusion around a lot of things. One of them is the word digital transformation, what it means. Another one is actually the word digital in digital transformation. Increasingly, we see clients who tend to only look at the new objects, so health tech, artificial intelligence, wearables, genomics, predictive analytics, blockchain, all of those things. and tend to see, let's say, omni-channel as not digital, as something that's already done and not important. For me and for across health, digital transformation is the two parts. So digitizing the core, as we call it, is important. It's not easy. It takes a lot of time, but it will actually release a lot of budgets and resources to spend on the mid-term future, which is actually the right side. So developing innovative digital health business models, looking at all those new technologies. None of them is, let's say, ready to hit the market at scale, but you need to actually jockey for position in this, because this is where the big tech companies and some startups perhaps will play as well. So digitizing the core is key. I think the second wave of that is coming. So pharma has been doing quite a lot of initial projects. Now the strategic level is being reached, where it's not about optimal campaigns, but it's about optimal resource allocation, so offline versus online. That whole, I think, drive towards resource optimization is happening now, and that's certainly something where digital plays a key role, and that's what CEOs, etc., do see. So you need to have a little bit of both to actually make your strategy a success. If you ignore one, you will ignore it at your peril, I think. So just a few more tips on if you're doing your digital strategy already, or if you're working on it, maybe a checklist. If you meet, let's say, all of these 8, you're doing a good job. Yeah. So this is from Bain. So you shouldn't plan to plan. So really develop extensive slide decks focusing on enablers without any real business value. It should not be pure experimentation. A lot of experiments have been done already somewhere in your market or by other companies. You really need to scale them at this moment in time. Certainly the low-hanging fruits. Blind spots, just as I just mentioned, digitizing the core versus health tech. You can't have either or. You can't ignore specific elements. You need to look at it holistically. Scattershots, spend a lot of budget across very small topics without any strategy. It shouldn't be nearsighted only. That means it shouldn't be digitizing the core only. It shouldn't be far-sighted only. That means digital health only. It shouldn't be Big Brother, where you centralize everything and ignore, let's say, the lack of ownership at the local level. And it shouldn't be islands either. So there should be some level of governance, however light it might be, place as well. So if you're running a project and you are looking at these things and you do well, I think then you're probably on the road to success. Maybe just one note on the very positive numbers you see in the beginning. It makes me a bit worried as well that pharma doesn't really understand what digital transformation actually is. So generally speaking, I think under 20%, maybe 15% of companies in any industry feel that transformation is a success. If you look at the results we get here, it's much more. So there's a big gap between those, let's say, other industries and pharma. And maybe pharma doesn't really know what digital transformation really is all about. Maybe they see digital transformation as rolling out digital tools, etc., as being the thing to do. I strongly believe that's not the case. I strongly believe that there is a need to shift some of the new resources to other stakeholders, that there is a strong need to reduce some of the old models in, let's say, the HCP area, and there's certainly also a big need to proactively start looking at health tech as well. So maybe pharma doesn't really get the meaning of new business model here. So there is no right and wrong. There is no, let's say, no good answer to all of those things. It all depends on your country. It all depends on your TA, on your immediate competitors, on the ambition of your CEO, all of those things. But if you're going on in this long journey, we can offer you a few tools to help you. So you've seen that training and skills is one of the key components, but also key hurdles. We have quite a few offerings in that space in the accelerator range. Multichannel Maturometer helps you define the as-is, which a lot of you mentioned as key, to know what the burning platform is, to know where you are. So you can run these as well. And then the navigator, of course, helps you define the right channel mix, omni-channel mix going forward. And also helps you benchmark versus the competition. I think that's increasingly important. One other component that we just launched, it's in pilot phase, is actually the Multichannel Maturometer for field force. We all know this group is using new tools, has to adopt new approaches. So for that specific purpose, we actually developed this one. If you're interested in learning more, please send an email to Sander, and he can certainly tell you more about that as well. So that being said, I want to thank you for your time. I hope you found the session useful. I think digital transformation is certainly here to stay. There's a second wave coming. I think it's the most strategic wave. The interesting, I think, elements from the couple of slides that you've seen is that there is a difference between early starters and companies that have advanced. You can see some learning around change management being important, skills being important, and all of those things. I do hope you've taken away something from this, and wish you well on your journey, and hope to see you somewhere soon. Thank you very much.